Hello, this is Dr. David Green, CEO of the Colorado Pain Network. The topic today is what you need to know about facet joint syndrome. At each level of the spine, there are two facet joints. You can see here the back of the lumbar spine. You have a facet joint on the left, one on the right, then you go below, left, right. Okay, they're about the size of a thumbnail, and they contain cartilage just like other mobile joints, including the hip and the knee. Collectively, they allow individuals a very impressive spinal range of motion. Even though they're small, though, they can be a tremendous source of pain. Facet joint arthritis begins initially in the disc. This is looking from the front. You can see a healthy disc here, a healthy disc here. This one's degenerative and bulging, and there's a loss of height. Okay, that shifts pressures to the back of the spine. Those abnormal forces can cause arthritis, like you see here with the bony overgrowth and the ratty appearance. Okay, and it can even inflame nerve roots because of the overgrowth. Why is facet arthritis more complicated than hip or knee arthritis? Well, there really is no effective facet replacement like there is in the hip or the knee. Hip and knee replacement are two of the best quality of life operations we have. There are two facet joints at every spinal level, and usually multiple are affected. So if you have joint arthritis in the facets at one level, usually you have it at several. There's over 40 facet joints altogether, so there's a lot more of them than the hip or the knee. Even small joints may produce significant pain, or maybe none at all. Why do people develop facet syndrome? Well, usually it's from degenerative wear and tear with osteoarthritis. Post-traumatic degeneration may occur. One example would be whiplash. We know that the whiplash injury typically incurs injury to facet joints, and that may show up as post-traumatic arthritis. There's also a genetic component that we don't really understand very well. How's the problem diagnosed? Well, history and physical exam can be very helpful, and x-rays can be highly suggestive. Keep in mind, though, that even if you have significant facet arthritis on x-rays, the patient may have no pain whatsoever. Okay? Interventional procedures can be helpful. This is a medial branch block. These are actually medial branch nerve endings that supply sensation to this joint. So if you block the sensation from those joints, you can get pain relief if they're the cause of pain. So it can be a diagnostic injection, and it also can provide 3 months on average of pain relief. A facet joint injection actually has the same potential, but it's put right into the joint. All right. What treatments are available for facet joint syndrome? Well, first of all, over-the-counter medications like nonsteroidal anti-inflammatories and Tylenol can be very effective. For short-term exacerbations, opiates can be helpful. On the long term, they're not really a great idea. And then prescription pain creams can be helpful as well. Physical therapy and chiropractic treatment can help. TENS units are about the size of an iPhone, and they have wires that attach to foam pads over the skin, and they can help with pain relief. And then spinal decompression therapy can be very helpful. You can see that here. It's intermittent spinal traction. Interventional treatments, as mentioned, the medial branch block is a great treatment along with a diagnostic procedure. Here you see a facet joint right there. This is a nerve root, and then coming off of the nerve root are these medial branch nerves that supply sensation above and below. So if you do a medial branch block, you're actually deadening the sensation from these little nerve endings. You're not dealing with the nerve root, just those. That can be very helpful. The facet injections actually go into the joint itself. If those injections work and then the pain relief wears off weeks or months later, you can repeat them, or you can go on to a radiofrequency ablation. So here, just to back up a second, is a facet injection. Okay. And then here's a radiofrequency ablation. So what can happen is you have the injections before, the pain relief wears off. What happens here is the pain doctor is actually putting a catheter in and then heating up this area and deadening these nerve endings, and that can give pain relief from 6 to 18 months. What's a typical outcome of treatment for facet syndrome? Medial branch block has been shown to have 85% effectiveness with an average pain relief of 3 to 4 months. Very impressive. Radiofrequency ablation has an 80% excellent result profile with 6 to 18 months, and that can be repeated as necessary. All in all, over 95% of patients are able to achieve satisfactory non-operative outcome with facet syndrome. The top pain management clinics in the Denver metro area are Colorado Pain. They have several locations, over 50 Insurances are accepted by the board-certified pain doctors who offer both medical management with medications and interventional treatments like we just discussed here, and a lot more. The number to call for treatment is 720-306-9575, and visit us on the web at painmanagementdenverco.com. I'm Dr. David Green with the Colorado Pain Network. Your pain stops here.